Yes, Dr. Ahadian, continuing the issue with regard to genetic preconditions and how families and tribes and related genetic ancestorials work. Basically, when we look at certain problems like eating disorders, bipolar disorders, obsessive compulsive disorders, there are a certain way of looking at the matter of environmental versus genetic factors. And there's a lot of arguments that environment stress could cause certain kind of problems that could unconsciously motivate the person to be able to survive and therefore go through the phase of dealing with that, with obsessions, with problems with regard to controlling behavior, with eating disorder habits. However, there's another way of looking at that, and that is a genetic factor being there to begin with, which then makes the individual susceptible to drug and alcohol abuse, to behaviors with rejection, to womanizing behavior, to addiction, to gambling behavior, to passive aggressive behavior, and on and on and on and on. So basically, my experience personally has been basically related issues with genetic precondition. When you look back in a family and in a tribe of a family, going back to the ancestral genome of that family, you see a lot of ongoing traits related to a nature of this family as a whole. Of certain families you see more obsessed, certain families you see more gambling in them, certain families you see drug and alcohol abuse, certain families you see a lot of eating disorders, a lot of personality disorders that goes all along in the family. Bipolar disorder, it goes in the family, and genetic preconditions. So basically, it's interesting to have that kind of concept, and then at the same time to have a notion of this dissociative disorder that we were talking about in the previous videos, about how the trauma in childhood causes expression of these kind of disorders, and then treatment of that with antidepressant and and mood stabilizing medications. There's a lot of them at this point that I feel very confident about, that helps them, and then helping through the management of stability of a person in an environment to decrease those kind of expressions of dissociation, and therapy, which is very important. Thank you very much.